The United Kingdom is still grappling with the aftermath of the COVID-19 pandemic. And now it faces the potential threat of another dangerous illness known as the Crimean Congo hemorrhagic fever, CCHF in short. Scientists have cautioned that there is a significant likelihood of this disease making its way to the UK. In this video, we will discuss 4 major points. What is CCHF, its symptoms, treatment and precautions, climate change diseases link and conclusion. Let us start with point 1. What is Crimean Congo hemorrhagic fever? It is a viral illness primarily transmitted by ticks. Ticks we know are tiny parasites that feed on the blood of various animals, including mammals, birds and reptiles. This disease can also spread through direct contact with the blood or tissues of infected animals. The name of the virus stems from its initial identification in the Crimean Peninsula and the Congo Basin in Africa. CCHF is prevalent in regions such as Africa, the Middle East and Asia. The World Health Organization reports that CCHF has a mortality rate of up to 40%, making it a highly severe disease that is challenging to prevent and treat. To put it into perspective, the mortality rate of COVID-19, even among older adults with underlying health conditions, is less than 20%, and for younger individuals, it is below 5%. In contrast, CCHF has a significantly higher fatality rate, with nearly every other patient succumbing to the illness. That was some basic information about the disease. Now let us move on to point number 2, symptoms, treatment and precautions. So this disease typically manifests its symptoms within a range of 2 to 14 days after exposure to the virus. These symptoms encompass fever, headache, muscle and back pain, as well as nausea, vomiting and diarrhea. In certain cases, patients may also experience bleeding from the gums, nose and other bodily openings. To diagnose CCHF, medical professionals analyze blood or tissue samples to detect the presence of the virus. Unfortunately, no vaccine is currently available for preventing CCHF, and there is no specific treatment available for the disease. However, supportive care can enhance the chances of survival. This may involve administering fluids, electrolytes, and blood transfusions. Preventive measures can be taken to reduce the risk of infection, such as avoiding contact with ticks, wearing protective clothing in tick-prone areas, and using insect repellent. Scientists have cautioned that as the planet warms, certain tick-borne infections like CCHF are highly likely to spread in the UK and elsewhere. The worst part is that the warming of the planet could also create favorable conditions for the emergence of other diseases, including Rift Valley fever, Zika, and breakbone fever. And that brings us to point 3. Climate change is exerting a significant influence on the distribution of diseases. How? By altering the geographical patterns in which they occur. The rising global temperatures are creating favorable environments for disease-carrying insects and animals. That is dangerous, as it is enabling the spread of diseases that were previously limited to tropical regions into temperate areas. An illustration of this phenomenon is the expansion of mosquito-borne diseases like malaria and dengue. Traditionally, these diseases were prevalent in tropical and subtropical regions. However, due to climate change, the habitats of mosquitoes carrying these diseases are broadening. Consequently, these diseases are now being reported in regions that were once considered free from such health risks. Thus, climate change is increasing the likelihood of disease transmission to previously unaffected areas. Furthermore, the warmer temperatures resulting from climate change are creating optimal conditions for the proliferation and dissemination of disease-causing pathogens, and that is amplifying the prevalence of various illnesses. Climate change not only facilitates the spread of existing diseases, but also enhances the likelihood of new diseases. For instance, the melting of glaciers is releasing ancient viruses and bacteria that have been preserved for centuries. These long dormant microorganisms pose a potential threat to human health if they manage to propagate and cause infections. Now let us conclude our video. The alteration of the disease landscape poses a significant risk to worldwide health. And as climate change persists, it is probable that additional diseases will arise and propagate. Therefore, it is crucial to implement measures that curb greenhouse gas emissions and alleviate the consequences of climate change. It is easy to overlook the fact that we are temporary inhabitants of this planet. When we interfere with the intricate equilibrium of nature, it reacts in response. The powerful backlash from nature serves as a reminder of our position in the broader context of existence.